Let's go.
52% of employees in the US get their health insurance through employers. And what we do as employers to take our voice up to the next level, so we influence policy, we influence what the market does, that's where we need to go. And I think what you'll hear today as we go on this journey is you'll hear from a lot of the different stakeholders.
I once heard a hospital CFO say, you got to understand, Mike, the challenge we're facing is we're trying to disassemble the plane and reassemble the plane in this conversion from fee-for-service to fee-for-value while we're flying it at 30,000 feet.
We're changing diseases that used to be fatal into chronic conditions now, and it's completely changing the way we have to think about how we finance the risk.
What I found is reading is fundamental. As we all know, as benefit experts, no one reads anything. No one.
All of our collective ability to reinvest and innovate and new technologies and AI and upskill our workforce and compete in the modern competitive economy. If we don't do something about healthcare, it is a drag on each one of your businesses. We're going to be left behind. And those companies that figure this out, or those countries that figure this out, are going to be able to outmaneuver us.
We really believe in what we think of as like the 3 Ps, right? So we look at our programs in terms of our pharmacy, our programming, our prevention programming, and then also as well as our plan design.
I feel really discouraged about that. I think it also presents us with a moment of real opportunity, because how we engage people, how we support employees around navigating, around understanding, around getting the most from their care can actually really turn the tide as it relates to that cost challenge.
Our seniors, our students, but we also have to know that every one of us has a role. I'm blessed to work in Harrisburg, but you can easily get in touch with anybody in Harrisburg, including your representative and your senator, to let them know that these priorities are something that you share, or whatever your priority is.
Everyone that's here, they're actually all morally aligned to giving a better solution for these plans. We spend so much time going to events where that's not oftentimes the case. And so if you think about just the return on investment from a time perspective, you can go here and everyone's already trying to find real solutions to real problems, versus the other events you may go to where you have to scan the room for so long to figure out what groups to speak with to actually go through and start having fruitful discussions to actually be like a real solution provider.